Hey everybody, and welcome back to Psychology Geek. In today's video, we will look at 10 signs your body needs more magnesium. Before we go straight into the video, subscribe to this channel for more videos like this. Magnesium is present in all of our body cells. It aids in the conversion of food into energy, as well as the regulation of your nervous system and the production of new proteins. Because the mineral is involved in over 300 metabolic occurrences in the body, it has an impact on blood pressure, metabolism, and immune function. Ensuring enough supplies is critical. So what exactly is magnesium? It is a mineral that can be found on the surface of the earth, in the sea, in plants, animals, and in humans. Magnesium is mostly found in your bones, 60%, with the balance in your muscles, soft tissues, and fluids. Magnesium is required for the proper functioning of every cell in your body. Magnesium is necessary for energy production, protein synthesis, gene maintenance, muscular contractions, and nervous system modulation. As a result, getting enough magnesium should be a top priority for everyone. But what if you're not receiving enough of it? Magnesium insufficiency might be difficult to detect. Some of the symptoms don't occur until your magnesium levels are very low. Another issue that people have is getting to the bottom of the problem with their doctors. Because the symptoms of magnesium insufficiency are sometimes vague, doctors may mistakenly suspect other illnesses or deficiencies. However, if you are aware of the signs and symptoms, you will be able to determine when you should seek medical assistance and advocate for yourself. So here are the 10 signs your body needs more magnesium. 1. Muscle cramps and spasms. More individuals are aware that muscle cramps are an indication of magnesium insufficiency, thanks to the rise of the fitness culture. Magnesium is important for relaxing muscles and controlling muscular contractions. Indeed, you may have heard of or taken an Epsom salt bath after a hard workout, which is one form of the crucial mineral magnesium sulfate. However, a lack can result in physical symptoms such as tremors and even convulsions in addition to cramping. Unfortunately, even though studies suggest that supplementing with magnesium can help ease cramps and twitches in other groups of people who are deficient, it isn't as simple for older folks who are having muscular discomfort. Magnesium insufficiency can also lead to hypocalcemia, or a lack of calcium, which can result in muscle spasms and cramps. As a result, really getting rid of them will very certainly necessitate the repair of both diseases. 2. Osteoporosis. You're probably aware that vitamins, notably vitamin D and K, as well as old age, play a role in your chances of getting osteoporosis. Magnesium deficiency also puts patients at a higher risk of developing osteoporosis, a disorder that weakens bones and puts them at risk of fractures. Getting adequate magnesium, on the other hand, can benefit in a variety of ways. Magnesium deficiency is linked to lower bone mineral density and can lead to hypocalcemia. Though magnesium deficiency can have a direct effect on your bones, it can also weaken them by generating a calcium deficiency. Of course, they are only a few signs and symptoms of a magnesium deficiency. Even if a deficiency is present, each person may experience all, some, or none of these symptoms. 3. Irregular heartbeat. Magnesium is essential for heart health and regulation. Therefore, not getting enough of it might cause serious problems. One of the more serious implications of magnesium deficiency is a heart arrhythmia or irregular heartbeat, which should be handled carefully. This condition is hypothesized to be caused by potassium imbalance produced by a magnesium deficit, similar to muscle weakness and weariness. Lightheadedness, chest pain, shortness of breath, and even fainting are all indications of arrhythmia. It can also put you at risk of heart failure or stroke, so talk to your doctor if you see any of these signs or symptoms. 4. Struggle to exercise or get through a workout. Magnesium deficiency is associated with muscle weariness and exhaustion. This could be a clue that you need to raise your magnesium intake, especially if you're used to be able to crushing your morning workout or have the energy for an evening walk, regardless of whether you feel like it. low magnesium levels appear to be connected to low potassium levels, and a magnesium-deficient diet can deplete our potassium stores, which is required for effective exercise recovery. 5. Trouble sleeping. While a lack of magnesium can make you feel tired, it doesn't guarantee you won't get a decent night's rest. Much promising research has shown that magnesium, in the form of a neurotransmitter called GABA or GABA, can improve sleep quality. GABA helps you fall asleep faster by slowing down your thoughts. If you don't get enough magnesium in your diet, you may experience racing thoughts and poor stress management at night when all you want to do is sleep. 6. Cravings for chocolates. We'd all like to eat chocolate every day, all the time. But we're discussing a more serious problem. If you find yourself craving chocolate more frequently than once a month or the week before your period, it could be an indication that you need to increase your magnesium intake. Dark chocolate is abundant in magnesium, with just 1 ounce providing 10% of your daily requirement. However, a chocolate craving could be caused by a lack of sleep or additional stress, among other things, so don't get too worked up about it. 7. Always constipated. Yes, a lack of magnesium can lead to a lack of bowel movement. For the most part, foods high in magnesium are also high in fibre. So if you don't receive enough magnesium, you're probably not getting enough fibre, which indicates irregularity in your digestive system. Just be careful not to overdo it on the magnesium. Too much can cause problems with your bowels. 8. Change in personality. When you're sick, you never feel like yourself, and if your magnesium intake isn't up to par, you might not act like yourself too. Personality changes, such as apathy, characterized by numbness and a lack of feeling, might occur and can cause delirium and coma if magnesium levels are low enough. In addition, a meta-analysis discovered a link between low magnesium levels and a higher risk of depression. 9. Weakness. You'll almost certainly associate exhaustion and weakness. Inadequate magnesium consumption is likely to produce myasthenia, a fancy name for muscle weakness because this mineral plays such an important part in appropriate muscle functioning. More on that in a minute. This is due to the fact that magnesium insufficiency is linked to a decrease in potassium levels in the muscle cells, a condition known as hypokalemia. Scientists believe that muscle weakness is caused by a lack of potassium. 10. Other symptoms. Magnesium is at the top of the list of vitamins and minerals that act together. It's required for calcium, potassium, vitamin K, vitamin D, and other nutrients to be properly utilised. The body can absorb what it needs without absorbing too much magnesium when it is applied externally or transdermally, over the skin. Diagnostic and testing. This is where the symptoms that aren't particular come into play. Because it's difficult to pinpoint what's causing symptoms like exhaustion and loss of appetite, your doctor will use a range of techniques to diagnose you. They'll probably consider your symptoms as well as your medical history, a physical exam, and a blood test. Although testing your blood magnesium level does not provide a complete picture of magnesium deficit, much of your magnesium is stored in your bones and soft tissues. It can aid in the formation of a picture of magnesium deficiency. What to do if you have a magnesium deficiency? Fortunately, putting our magnesium levels back on track isn't difficult. However, in other cases, such as if you have diarrhea or other malabsorption disorders in your gut, it may take longer. However, magnesium supplements can cause some side effects, the most common of which is loose stools or diarrhea. This impact is amplified if you consume magnesium citrate, which is known to increase water retention in the intestines. If you discover that taking oral magnesium makes you feel nauseous, plan your meals to introduce dietary magnesium. Before taking dietary supplements, anyone with specific health issues such as kidney disease or those taking medications such as bisphosphonates, antibiotics, diuretics, and proton pump inhibitors should see their doctor. Magnesium-rich foods such as leafy greens, whole grains, avocado, and cashews are widely available and provide additional health advantages in addition to magnesium. If a medical practitioner prescribes a magnesium supplement plan, stick to it. Having too much magnesium can be harmful as well. Magnesium deficiency affects almost everyone. However, if you take effort to eat more magnesium-rich foods or supplements, it is a pretty simple shortage to remedy. If you have any of the symptoms listed above, see your doctor and/or get a blood test to see if you are deficient. At the absolute least, eating more magnesium-rich foods will lower your risk of artery hardening, improve your sleep, and help you maintain a healthy mood.